All right, good afternoon, everyone. So first off, a big thank you to everyone for attending the webinar, Designing Out Pain, a Roadmap to an Effective MSI Prevention Program. Really excited to again and share this information because it's such an important topic. During the session today, we had lots of questions come in, which was awesome. We didn't get a chance to get to all of them, so I just wanted to take a little time to kind of follow up on some of those questions that we had remaining. The first one that comes from Daniel, who notes that he likes this differentiation that we talked about between acute and these kind of delayed onset MSIs, these cumulative MSIs. And that he commented that in his experience, organizations tend to focus more on the acute injuries, which I totally agree with. And they don't prioritize these delayed onset MSIs or occupational diseases. I think that's so true, and I think that's why it's so critically important in particular, when we talk with frontline employees, we want to make sure we help them understand this distinction. But when we talk with our leadership within our organization, when we talk about the decision makers in our organization, it's also really, really critical that they understand this distinction because it then feeds into how we make decisions about how work is structured, how we design the work, what equipment we put in place. How do we consider this idea of, again, minimizing that accumulated fatigue, building good processes around that so that, again, we can prevent these more cumulative exposures. Again, that's why I like to make that distinction because if we think about everything from the acute perspective, we maybe miss a lot of what's driving the risk, a lot of what's contributing to that risk for injury. The other thing I think about too is from a risk control perspective, understanding that cumulative exposure is really helpful to then us making good decisions about the different ways we could influence risk. If I do a job where one of the tasks, I'm using a lot of my back, I'm doing a lot of back bending, repetitive back bending to perform that task. And I have another task that I perform over the course of the day as well that's very similar in terms of also a lot of back bend, using that same body part in a similar way. Maybe there's one place where I'm just having a really hard time finding a way to effectively control that risk, finding a way to reduce or eliminate that back bending. If I'm able to do it somewhere else, that contributes to that total risk reduction, to that fatigue reduction I'm experiencing over the day. Imagine if I made you a workout and you had multiple different exercises you were performing for a given body part. If I take one of those exercises out, it's going to reduce the specific fatigue to that area. And so from a work perspective, we can kind of tackle the problem in a similar way if we understand how it's accumulating, this cumulative impact of these MSIs, especially over time. So really great insight there, Daniel, and I appreciate you sharing that. And again, I think really critical having these conversations, communicating these ideas to your organizational leaders as well, so that they understand from a risk management perspective, what's different? How do we attack this problem as effectively as possible? Another person asked, how do we prevent MSI fraud? So musculoskeletal injury reporting, injury fraud. The one note I kind of want to start with here, I get questions around, injury reporting, injury fraud a lot. I think firstly, importantly, is to recognize that when we look at the data, this really isn't a prevalent problem, right? The vast majority of MSI injuries that happen, of the reporting that happens, is real, is because of exposures to these ergonomic risk factors in the workplace, is because of these physical demands that are placed on workers when they perform their job. And so we want to make sure that we're not so concerned with this challenge that it's impacting our ability to actually address what's really present, the risk that's actually out there, the exposures that are actually happening. And actually, we want to make sure we're focusing on addressing those things, right? The other thing is, if you haven't done your due diligence as an organization to go out there and identify, create your job task inventory, identify these risks, actually do an assessment to assess the level of exposure to ergonomic risks for a given job, for a given job task, there's really no way of you making the justification that someone didn't get an MSI as a result of that job. Well, you haven't done your part in terms of assessing the level of risk, assessing what exposure to those MSIs are for that given job task. And so that's also why it's really important from an organizational perspective. If we want to set ourselves up for success, it's also important that we have that clear documentation. We have that clear risk management process. We're clearly calling out what the risks are, what the risk level is when it comes to specific areas, so that if you do have to manage a scenario like this, you have that information that you can work back from. I think that's really, really critical. But again, I think understanding that the reality is this isn't that prevalent of a challenge, and really it's more the challenge is that there is a lot of ergonomic risk, that there is very physical risk work that exists out there, that people are being exposed to these things in the workplace, and it's leading to a lot of these injuries. The last question we have here before we wrap up, Alshin shared that they have challenges with folks tripping off sidewalks and similar incidents. So sounds like partially, potentially some walking, working surface risk factors that are present there. They've been training their team on the importance of being aware of the surroundings and the personal activities or the activities that the people are performing. But are there any other thoughts in terms of how they could address this challenge? So, great question. I think oftentimes, when we talk about ergonomics, a lot of times there's other aspects, walking, working surface elements that may be at play as well. I think the big thing, again, much like what I just talked about when it comes to risk management, having a risk assessment process, right? Not just doing training to educate workers, but also doing your due diligence as an employer to go out there and do risk assessments on walking working surface exposures. What are the risks for slips, trips, falls? Have you prioritized and implemented controls where you've seen these high rate of incidents? So it's really critical that we educate workers, that we help them understand what risks are present, but it's also important that we, as employers, as an organization, that we're doing our work to assess the risk, drive through the risk management process, implement risk controls, to mitigate exposure to those things. If we only ever rely on behavior, it's going to be really challenging to fix the problem long term. We need to improve the system. We need to improve the design of the work in order to minimize the risk. That's true of ergonomics. That's true of safety in general, right? When we approach safety, that's part of the philosophy that we need to take. With that, that's the last of the questions that we had. Again, please reach out to me if you guys have follow-up questions that weren't answered during the webinar itself, and I'm happy to answer those as well. Have a good day.